Hi, and welcome to another episode of the Rotator Cuff Expert. My name is Dr. Daniel Orcutt, and in this forum, we talk about options for rotator cuff repair, what happens to the rotator cuff, what happens to the shoulder, and what options we have. Now, this is part 2 in a series of what happens if you have a failed rotator cuff repair. No matter what, if you do enough rotator cuff repairs as a surgeon, some will fail, which means they will re-tear or they won't heal. And when that happens, we have options. In the first episode, we talked about why they might not heal and what options we have as far as re-repair, what other things we could do differently in the second time around, what the difference as far as advantages, disadvantages, and of what we might do. And then briefly touched on 2 other options, and we're going to talk about one of those options today, and that's called a reverse shoulder replacement. So reverse shoulder replacement is the opposite of a shoulder replacement. So if we look at the shoulder joint, we see here, this is the socket and this is the ball, and this is the normal shoulder, and this represents the rotator cuff up on top. And so if we were to do a shoulder replacement, a standard or what we call anatomic shoulder replacement, it would look like this, where we have the socket and we have the ball. So we're just replacing the ball and the socket. And then they work the same way as if you had a shoulder, a normal shoulder, or a shoulder with your bones and your ligaments. Now the problem with when you have a shoulder replacement, what is required is a rotator cuff. So the rotator cuff, as we know, is a cuff of muscle or tissue and tendon that holds the ball in the socket. So if you have a rotator cuff, then and you have arthritis in your shoulder, you get a rotator cuff, then you get an anatomic shoulder replacement. So the anatomic shoulder replacement is like this, and so the rotator cuff holds the ball in the socket, and then you can elevate, all right? So that you can go way up. If, unfortunately, you have a rotator cuff deficient shoulder and you put a shoulder replacement, or you leave, excuse me, a normal shoulder in there, what happens is there's no pushing of the shoulder of the ball into the socket. And so what happens is you slide up, and you can only go so far, because what you do is slide up and you hit the acromion, which is the top of the shoulder. So you hit that. So without a rotator cuff, a replacement, a standard replacement, you would get to about here, and then your motion would stop, because what you need is a rotator cuff to push it down and center it so you can get up higher. So that's why we don't do a standard or an anatomic shoulder replacement for a deficient rotator cuff. We only do a reverse shoulder replacement for a few populations, because it is obviously an irreversible process. Once we do the cuts for a rotator cuff or for a shoulder replacement, we can't undo that, right? And so even in an anatomic, same thing. So in anatomic, what we do is we will cut that off, right? And replace it with the stem that goes down. And then we'll shave this off and we'll put the new socket in. So in a reverse, we do a similar thing, except we reverse it, where this is a picture. So the ball becomes the socket and the socket becomes the ball. Now, why do you do that? Why does that matter? So in the biomechanics of a reverse shoulder replacement, when we do that, we medialize, which means we bring it to the center, and we distalize, we bring it down. And when we medialize and distalize, that creates a better lever arm for the deltoid. So if you have that, then you don't need the rotator cuff to hold it in the socket, because the deltoid will be able to do that. So the reverse shoulder looks like this, right? So the ball is where the socket used to be, and then the socket is where the ball used to be. So it articulates this, and again, it medializes and inferiorizes the position, or the chora, the center of motion of the joint, and that allows the big deltoid to work. We do have to have a deltoid that works, otherwise a reverse won't work. And so what we test in the office is we make people try to elevate the arm. And so if you have a what we call a pseudo paralysis, which means you're not paralyzed, but because the muscles don't work anymore, they're not attached anymore through the rotator cuff, you can only go to here. That's what we call pseudo paralysis, and that will be an evidence the rotator cuff has failed, in that a rotator cuff replacing option would be a possibility. And then again, that is a reverse shoulder replacement. The unusual benefit of having a reverse total shoulder is it actually sometimes, believe it or not, is a little less painful than a revision rotator cuff repair, and is actually quite a bit less restrictive. Because when we do a rotator cuff repair, especially the second time around, we want to be really careful with your motion. So we're going to lock you in, not have you move very much, a much slower potential recovery than the first time around rotator cuff repair. And as far as the reverse total shoulder, there is less typically, and again, it depends on the surgeon, but there's less restrictions as far as what you can and can't do early on. You do have a big incision here. Unlike if you have a typical rotator cuff repair where you may have just a little incision for the arthroscopic procedure, or you may have a small incision down here if they did an open procedure, but you'd have a bigger incision, a bigger procedure done inside your shoulder, but perhaps less pain and less restrictions early on after the replacement. The advantage of doing this, again, is we don't need to re-repair a rotator cuff that's perhaps really crappy tissue, thin, has failed, right? So when we re-repair one of those, it's unclear how beneficial or how well that's going to do, because it can re-tear again. When you put in a reverse, we don't care about the rotator cuff anymore. And that's fine, but it comes with its own set of consequences. One, you can't reverse it. You cut the bone, you can't uncut the bone. And why is that important? Well, that's important because the duration, the longevity of this. And so we're putting metal pieces into places where there's not a lot of bone, specifically the glenoid or the socket. And so that socket or that glenoid piece can over time loosen if we have a very active or very young person. So this is a option that we would give for an older or less active person that won't worry about it loosening over time. We do not put this in manual laborers, we do not put this in young people, because they will loosen it over time and will have a perhaps an unsolvable problem if this rotator cuff replacing or reverse shoulder replacement fails. There's not a lot of great options after that. There are some salvage options, but again, nothing that you'd want in a 30 or a 40-year-old or a very active person. So we don't want to do it in young people. So this is really limited for lower active and older people. And another downside with this is that it doesn't provide the motion as an anatomic would or as a normal shoulder. So full range of motion this way and this way, forward flexion, abduction, external rotation. You wouldn't get a normal motion. You'd have a better motion than this, pseudoparalysis. You know, the idea is to be able to get up to here, get to your face, get the back of your head, but you wouldn't be normal motion. And it won't be normal power either. A well-performing shoulder will have much more power than a well-performing reverse total shoulder. So that's another downside. And so the power and the decreased range of motion are the longevity of how long it may last, and the limitations, the restrictions we will put on someone who has a reverse is the reason why it's not a good option for everybody. It is a very good option, an option we use from time to time to help us out with a difficult situation when we have a failed rotator cuff repair that doesn't appear to be amenable or be able to treat it with a revision of the rotator cuff repair. So this is another option. There's one more option called SCR, or superior capsule reconstruction, and we'll talk about that in the next episode. But for now, a reverse total shoulder replacement for a failed rotator cuff repair is a good option for a certain population. So if you have this issue, talk to your doctor. It's important to talk to your doctor, your orthopedic surgeon, about this because one, it's important to know all your options, and two, sometimes people who do rotator cuff repairs don't do reverse total shoulders. And so you want to make sure, if it's an option for you and your surgeon doesn't do a reverse total shoulder, it may be beneficial for you to have another opinion or talk with a partner of his or her that does reverse and so you can have all the information and make your decision wisely. Okay, thanks so much for watching. Please like, please comment down below, and we'll see you again for another rotator cuff expert. Have a great day.